But now let's look at the 4-year data. And the 4-year data for valactocogene roxaparvovec, which is BMN 270, shows a somewhat different story. We're now looking at the chromogenic assay, and so at 1 year, this high dose group is 64%, and the medium dose group is about 21%. And then what we can see as we go to year 2, year 3, and then year 4 is a gradual diminution of the factor VIII levels that had been measured in the patients. We continue to see high variability in the patients from the interquartile ranges that are shown for a number of different time points here as well. And there is a loss of durability then in a number of patients. Bleed protection is largely maintained, as you would expect, since most of the patients are expressing some levels of factor VIII. And that's shown here. When one looks at the bleeding rate, one can see before infusion and then each of the years after infusion that the bleeding rate remains very low. But we would expect that. We also have seen in this trial that factor supplementation is required for surgery as well as for some of the traumatic bleeds. And that's what's shown here. And then many of the authors of all of these papers talk about a remarkable 90+% drop in bleeding events. But most of these patients are over 5%, so it's really not remarkable. These are expected values, and they point to the fact that the bleeding rate is not a sensitive marker of success. It doesn't distinguish between a 5 and 10% level and a 100% level. And that's something we have discussed in the past as well.